Bovine Neonatal Pancytopenia, or bleeding calf syndrome, is a disease of calves that appeared in mainland Europe in 2007, in the UK in 2009, and in New Zealand in 2011. More than 4,500 confirmed cases were reported across Europe between March 2009 and February 2011. Calves of all ages and breeds produce affected calves, and the incidence on most affected farms is usually low, often with only one case per farm, but occasionally up to 10%. Some clustering of cases has been reported, with particular farms or familial lines appearing to have a greater incidence of disease. So what is BNP? BNP is a hemorrhagic disease of calves less than 1 month old, characterised by profound depletion of peripheral blood and bone marrow cells. Typically, at the onset of clinical signs, haematology shows a profound thrombocytopenia, and as platelets are responsible for blood clotting, it is this that results in the clinical signs of hemorrhage. Calves also show a profound leukopenia, comprised of a neutropenia, lymphopenia, and monocytopenia. A non-regenerative anemia may also be seen, depending on the extent of hemorrhage. Clinically affected calves have a high fatality rate, usually about 90%, although occasionally cases will recover without any intervention, indicating that at least in some cases, regeneration of bone marrow hematopoietic cells is possible. Cases of BNP typically present between 7 and 28 days of age. Clinical signs include bleeding from the nose and gum margins and from ear tag and injection sites. This can sometimes be subtle and may go unnoticed when calves are reared extensively. Petechiation is frequently seen on the gums and ventral tongue, but can be hard to visualise until anemia has developed and the mucous membranes have become pale. Often the majority of hemorrhage is internal, with calves presenting listless and anaemic, with few other signs, or simply being found dead. Post-mortem examination of these cases will often reveal extensive internal hemorrhage. Secondary infections are common, presumably due to the leukopenia, and may result in marked pyrexia. Bone marrow histopathology, ideally performed on samples taken from the sternum, shows massive depletion of marrow cells and can provide a definitive diagnosis. Early evidence of a link between BNP and colostrum came from the observation that twins or multi-suckled calves would often both be affected. It was also noticed that cows often produce affected calves on subsequent years, and a small trial we conducted in Edinburgh indicated that in these cows, the disease could be prevented by colostrum substitution. In order to verify the role of colostrum, we went on to perform a colostrum feeding experiment to address the question, will colostrum from cows that have produced a BNP calf induce the disease when fed to other unrelated calves? The experimental design was as follows. 10 calves from a BNP unaffected farm were snatched at birth before any colostrum ingestion. The calves were split into 2 groups. 5 were fed a pool of colostrum obtained from 9 cows that had previously produced a BNP calf, and 5 were fed a pool of colostrum obtained from BNP unaffected farms. Serial haematology samples were collected from the calves over the following 10 days, along with bone marrow biopsies. The haematology results from the experiment are shown in the graphs, with the calves fed BNP colostrum indicated in red, and those fed control colostrum indicated in blue. The calves fed BNP colostrum showed a massive reduction in platelets, lymphocytes, and monocytes compared to the calves fed control colostrum. There was also an early reduction in neutrophils. In addition, bone marrow samples from the calves fed BNP colostrum showed cell depletion typical of BNP. The results from this experiment confirmed that colostrum from BNP-affected cows will indeed induce the disease when fed to other unrelated calves. Careful analysis of all the results also allowed us to map the variable alloantibody damage to the different hematopoietic lineages seen with BNP. Soon after BNP emerged, a link was reported between the disease and vaccination of the dams of affected calves with Pregshaw BVD vaccine. Subsequently, 2 case control studies demonstrated a strong association between BNP and the administration of PregSure vaccine to the dams of affected calves. PregSure is a killed bovine viral diarrhea virus vaccine that was first launched in Europe in 2004 and was voluntarily withdrawn from the EU market in June 2010. To manufacture PregSure, BVD virus is grown in bovine cells. The cultured virus is then harvested, killed, and combined with a novel adjuvant. It has been shown that material from the bovine cells used to grow the virus remains in the vaccine preparation. However, despite the strong association between PregSure and BNP, the number of cases of BNP is low considering the widespread use of this vaccine. So, as not all PregSure vaccinated cows produce BNP calves, the pathogenesis of the disease must be more complex. The consensus is, therefore, that vaccination of particular cows with PregSure induces the production of harmful alloantibodies, antibodies against another member of the same species. These alloantibodies are unable to cross the bovine placenta, but are transmitted to the calf via the colostrum when it suckles. On ingestion, the alloantibodies lead to destruction of both peripheral blood and bone marrow cells, and this then leads to the clinical signs of hemorrhage seen in the calf. Evidence suggests that the production of alloantibodies by PregSure vaccinated cows is stimulated by bovine cellular material within the vaccine, originating from the production process. Specifically, MHC class I molecules from the vaccine cell line. This is because two separate studies have shown high levels of alloantibodies directed against MHC class I molecules in the blood of cows that have produced BNP calves. So, what exactly are MHC, or major histocompatibility complex, class I molecules? These are the proteins that determine tissue type. They are found on the surface of all nucleated cells, and the genes that encode them are highly polymorphic, having many variant alleles, meaning that within the cattle population there are a huge variety of different MHC types, many of which are still uncharacterized. The role of the MHC class I molecules is to display intracellular proteins to lymphocytes, allowing the recognition of self from non-self. And these molecules also determine the compatibility of donors for transplantation, and are the main antigens responsible for graft rejection. With this knowledge that BNP alloantibodies are specific for MHC class I molecules, we can expand our understanding of the pathogenesis of the disease, illustrated by the following simplified model. Current evidence indicates that on administration of PregSure to cows, the residual cellular material, combined with a powerful adjuvant, stimulates the production of harmful alloantibodies in some cows. If PregSure is administered to a cow with a similar MHC or tissue type to that contained within the vaccine, then no alloantibody is produced. However, if PregSure is administered to a cow with a different MHC type to that contained within the vaccine, it will be recognised as foreign. The cow will then produce alloantibodies against the injected MHC1 molecules in a similar manner to the reaction seen on the transplantation of unmatched tissues. If the cow is bred with a bull that has a different MHC type to that found in PregSure, then the resulting calf will not be susceptible. If, however, the cow is bred with a bull that has an MHC type similar to that found in PregSure, then the calf will be susceptible to the alloantibodies and will develop BNP once they are ingested. In summary, the tissue type of an individual cow will determine whether or not alloantibodies are produced in response to PregSure vaccination, and the paternally inherited tissue type of the calf will determine its susceptibility to these alloantibodies. We have recently confirmed that the alloantibodies found in the blood of PregSure vaccinated cows are specific for the MHC class I alleles found in the cell line used to produce PregSure. In other words, the alloantibodies are specific for the tissue type of the cells used to manufacture PregSure. Using laboratory tests, we have also shown that 50% of Preg-vaccinated cows produce these alloantibodies, and that the titers and specificities of these alloantibodies vary between individual cows, presumably reflecting differences in the cow's individual tissue types. In addition, we have evidence that Preg-vaccinated cows show a continuum of both alloantibody titer and alloantibody cross-reactivity, with those cows that produce sick calves having the highest alloantibody titers and alloantibodies that are cross-reactive with the most MHC types. However, the complex nature of the MHC makes predicting the likely responses of an individual cow or calf in a field situation almost impossible. In conclusion, studies in Edinburgh and by a number of other groups have indicated the following likely pathogenesis for BNP. BNP alloantibodies are generated in response to bovine cellular material, specifically MHC class I molecules, within Preg vaccine. Up to 50% of Preg vaccinated cows produce these alloantibodies, depending on their own individual tissue type, and these alloantibodies then cross-react to varying degrees with calves of other tissue types. The alloantibodies are transmitted via colostrum, and, on ingestion, they mediate rapid destruction of hematopoietic cells. This destruction is dependent on the titer of alloantibody produced by individual cows and the specificity of the alloantibody for the calf's MHC class I alleles. So, in the light of these findings, how should vets and farmers deal with BNP on farm? Calves affected by BNP should be handled as little as possible, as even gentle restraint can trigger bleeding. Administration of long-acting antibiotics is indicated due to the profound leukopenia and susceptibility of cases to secondary infections. While blood transfusions can produce an improvement, this is normally short-lived, and transfusions have been shown not to have a significant effect on mortality. The procedure also carries considerable risk, as the catheter may itself induce hemorrhage, as shown in the picture. If a transfusion is attempted, then only a Preg unvaccinated animal should be used as a blood donor, to minimise the risk of transfusing additional harmful alloantibodies. Careful monitoring of all BNP cases is essential, as internal hemorrhage can progress rapidly and cause significant distress to the animal. Prompt euthanasia is obviously indicated in such cases. Colostrum management is the key to preventing cases of BNP in Preg vaccinated cows. Cows that have produced a BNP calf have a high risk of producing further cases. However, any cow with a history of Preg vaccination should be considered at risk. We also know that once BNP alloantibodies have been generated, levels capable of inducing disease remain high for long periods. In such cows, feeding substitute colostrum obtained from Preg unvaccinated cows for the first 32 hours of life is known to be effective in preventing BNP. Ideally, substitute colostrum should be collected and stored from Preg unvaccinated cows on the same farm. Affected farms should avoid pooling colostrum. Due to the genetic differences between unrelated animals, colostrum from a Preg vaccinated cow represents a greater potential risk to other calves than to her own calf. In the longer term, culling of cows that have produced a BNP calf may be indicated.